Factors that have contributed to Patrick's respiratory symptoms include smoking and the fact that he does not exercise. Smoking for approximately 40 years of his life would have had a big effect on his COPD. Although Patrick gave up smoking years ago, his past history still put him at risk. Chemicals from smoking cause damage to the tissue and cells of the lungs. In fact, 80 to 90% of COPD cases are caused by smoking. He is overweight and walks slowly, therefore finds it hard to exercise. Exercise can help with respiratory conditions as it improves the breathing and clears mucus from the chest. However, Patrick cannot exercise, therefore suffers dyspnea. Factors contributing to Patrick's raised heart rate of 155 beats per minute include hypertension and left-sided heart failure. Hypertension often associated with an elevated heart rate. This is because high blood pressure increases the amount of blood reaching the heart. Therefore, the heart needs to beat faster. Left-sided heart failure causes poor blood supply to the heart muscle, so the heart is trying to compensate by beating faster to increase the amount of blood circulating. Heart failure may also mean part of the heart muscle is not functioning, therefore the remaining part is working harder and faster. Patrick has been diagnosed with COPD, which is likely to be caused from the fact Patrick smoked for approximately 40 years of his life, damaging the tissue and cells of the lungs. Patrick also doesn't exercise as he finds it hard to walk and is often immobile, increasing to his dyspnea. Left-sided heart failure has developed due to the fact Patrick has hypertension and has suffered from a myocardial infarction. Hypertension and MI are the two main causes of left-sided heart failure. Hypertension puts extra strain on the heart, causing heart failure, and MI can result in necrosis and a permanent loss of function. Both of these conditions could have developed independently. Patrick smoked for a great portion of his life, and this is a very likely cause for both conditions. Smoking can damage the lining of the artery and lead to a buildup of fatty material which narrows the artery. Both conditions may have also developed due to Patrick's weight and immobility. However, both conditions also have their own causes from different factors relating to Patrick's lifestyle. Although it is very likely both conditions were caused independently, COPD could have possibly been caused from left-sided heart failure, as it can cause complications in the lungs. Left-sided heart failure occurs when the left ventricle doesn't pump efficiently. This prevents the rest of the body from receiving enough oxygen-rich blood. The blood can then back up into the lungs instead and cause a shortness of breath and a buildup of fluid.
Patrick is high at risk for developing right-sided heart failure. This can be explained by risk factors including his current left-sided heart failure, an experienced MI to the right side, and a current pulmonary disease such as COPD. These risk factors for right-sided heart failure are shown in Patrick's medical history and clinical features. This can be explained with Patrick's pathophysiology, as the backward effect causes blood accumulation in veins and organs, causing peripheral edema in the patient. Additionally, the forward effect results in insufficient blood flow through the lungs, causing impairment of gas exchange, causing dysapnea and regular coughing. Both of these effects can be seen in Patrick's clinical features. Patrick has elevated triglyceride, elevated LDL, bad cholesterol, and low levels of HDL, good cholesterol, caused by his fatty diet, which are all contributing factors and further impact of atherosclerosis. This further narrowing of arteries is impacting on his risk for another MI episode. His hemoglobin blood count is also low. This impacts on blood perfusion and oxygen reaching needed cells. A reduced red blood cell count, anemia, may mean that heart failure has been caused by a decrease in the oxygen carrying capacity of the blood. This can impact on neurological function if cerebral blood flow is decreased and cells are lacking oxygen in the brain. The amount of time with insufficient oxygen supply will impact on the severity of the neurological outcome. Patrick's calcium levels are low in the blood. These low levels of calcium, also known as hypocalcemia, over time can affect the brain and cause neurological or psychological symptoms such as confusion, memory loss, and delirium. Next is his sodium and potassium levels, which are both high in the blood. These concentrations play a crucial role in neuron and muscle function. High sodium concentrations in the blood, also known as hypernatremia, cause dehydration and may also lead to alterations later on in brain function. Lastly is Patrick's glucose levels, which are high in his blood test. Prolonged exposure to hypoglycemia may have significant effects on the brain. Mild symptoms for hypoglycemia can be headaches, tiredness, blurred vision, hunger, and trouble with thinking or concentrating, whereas more severe damage can lead to permanent cell death in the brain tissue. This is a possibility for Patrick. Patrick's levels of troponin are going to be very high in a blood test. Normally, troponin levels should not be detected in the blood. However, when heart muscle is damaged, the release of intracellular contents, such as this protein, can be found in the blood. The more damage to the heart muscle, the greater levels of troponin can be found, showing the severity of heart muscle damage.